Hello, the CentraCare Health Urology team would like to welcome you to your online learning module. CentraCare Urology is a leader in urologic services in central Minnesota. We pride ourselves on excellent outcomes and creating the best experience possible for our patients. We perform a variety of state-of-the-art procedures to ensure our patients are receiving the most advanced services possible. Our experienced staff includes a multidisciplinary team of physicians, physician assistants, nurses, and a variety of care and support staff to assist you through every step of your surgical experience.
Hello, my name is Bill, and in this module a variety of topics are covered. You'll be able to select the topics that apply to you. While viewing the module, you may pause the video at any time and replay the information as often as you like. The topics covered include anatomy and general information, information on types of surgery, caring for urine drains using the Foley catheter, caring for surgical drains using the Jackson-Pratt or JP, what to expect when you go home from the hospital, and information on exercises, physical activity, and sexuality following surgery, information on patient support and support groups. But before we begin, we think it's important to understand exactly how your body works. So please watch this brief overview of the basic anatomy of the urology system.
The female urinary system is made up of the kidneys, which produce urine, the ureters, connecting the kidneys to the bladder, where urine is stored, and the urethra, the exit passageway from the bladder.
There are a variety of treatments for urological issues. In this section, we'll provide an overview of some of the surgical procedures that we offer, including the Da Vinci surgical system, which enables surgeons to perform operations through a few small incisions and has several key features, including magnified vision system, that gives surgeons a 3D HD view inside the patient's body, ergonomically designed console, where the surgeon sits while operating, patient-side cart, where the patient is positioned during surgery, wristed instruments that bend and rotate far greater than the human hand. The Da Vinci system is powered by robotic technology that allows the surgeon's hand movements to be translated into smaller, precise movements of tiny instruments inside the patient's body. One of the instruments is a laparoscope, a thin tube with a tiny camera and light at the end. The camera sends images to a video monitor in the operating room to guide doctors during surgery. The surgeon is 100% in control of the Da Vinci system at all times.
To understand what is going on in your bladder, a cystoscopy may be done. This is done by inserting a thin instrument called a cystoscope into your urethra. The urethra is the tube that carries urine out of your bladder. The cystoscope travels up your urethra and into your bladder, allowing the doctor to look at the inside of your bladder. Cystoscopy may be done alone or along with another procedure. When only a cystoscopy is done, a numbing medication is used at the insertion site, and the procedure usually takes less than 5 minutes. When a cystoscopy is done with another procedure, sedation or deep anesthesia may be used. The length of time it takes to complete the procedure varies based on what other procedures are being done. A cystectomy is a surgical procedure to remove all or part of the bladder. The surgeon will cut both ureters above the bladder. Men will have both vas deferens cut so the prostate can be removed. The urethra below the bladder is cut and the bladder is removed. After a cystectomy, if all of your bladder was removed, the surgeon will need to make a new way for urine to move from the kidneys to the outside of your body. During the procedure, lymph nodes in the area may be removed as well. The ureters are used to move the urine from your kidneys to the bladder. Since your bladder was removed, the surgeon may use a piece of your intestine and create a new tube from your ureters to an opening made on the skin of your belly. The new tube, made from your intestine, that moves the urine is called an ileal conduit. The opening made on your belly is called a stoma or urostomy. A small bag is placed over the opening or stoma to collect urine. The urine will come out continuously in small amounts, and the bag will need to be emptied when it is full. A cystectomy procedure is done under general anesthesia. It takes between 2 and 4 hours and usually has a hospital stay between 5 to 7 days.
Being constipated typically means having difficulty with bowel movements or infrequent bowel movements. Almost everyone has some degree of constipation in his or her lifetime. Although it's not usually serious, people often feel better when their system is regular. Some of the most common causes of constipation can include pain medication, recent surgery, limited mobility, dehydration, and a poor fiber diet. Treatment options that are typically used include an increase in water intake, high fiber diet, and stool softeners such as Colace and Miralax. In circumstances that severe constipation occurs, treatments like laxatives or enemas may be necessary and help relieve abdominal pain associated with constipation. If you're not passing any gas, have increased nausea, or your abdomen is distended and you're unable to have a bowel movement, contact your provider for further instructions. Your provider will often prescribe medications to you to help prevent constipation related to recent surgery.
I am having constipation. What can I do to help relieve this? A. Take a stool softener and drink more water. B. Drink more soda. C. Sit on the toilet for lengthy periods of time. D. Take more pain medication. The answer is A. Take a stool softener and drink more water.
Exercise and activity are very important after surgery. You'll be encouraged to get out of the bed and move the same day as your surgery. This is under the direct supervision of nursing staff. Your first time out of bed will be with the assistance of 2 staff members. You're given many medications in surgery that have side effects that can affect your balance. We don't want you to become dizzy and fall. After your post-surgical vital signs are completed, staff will encourage you to dangle your feet over the edge of your bed in a sitting position. They'll give you detailed instructions on standing and moving. This process is slow, with resting points during each step to ensure you're strong enough to move further without the risk of falling. The best thing to prevent blood clots is to get up on your feet again and walk. In order to prevent blood clots in the hospital, you'll be encouraged to move and pump your legs every hour while you're awake. You'll also be encouraged to cough and deep breathe after surgery. This means you need to take a deep breath to fully expand your lungs. This should be completed every hour while you're awake. The deep breaths often cause coughing as the lungs expand. The lung expansion helps to prevent pneumonia and other breathing complications that may occur after surgery. Nursing staff will remind you and encourage you to complete these exercises.
What kind of activity is expectable after surgery? A. Walking around the house. B. Deep breathing. C. Pump your legs and move your feet while you are awake. D. All of the above. The answer is D. All of the above.